Eponyms in medicine. Learning through names. Hello, learners. Today we're going to dive into a fascinating part of medical vocabulary. Eponyms. Eponyms in medicine refer to diseases, syndromes, medical devices, or surgical procedures that are named after the people who discovered or described them first. Despite the push towards more descriptive, less eponymic names, these terms are still widely used and are important to understand. An eponym is a word derived from the name of a person, whether real or fictional. A medical eponym is thus a disease, procedure, or anatomical feature named after a person. These are usually the physicians or scientists who first identified or codified the condition or procedure. For example, Alzheimer's disease is named after the German psychiatrist and neurologist Dr. Alois Alzheimer, who first described the symptoms and pathology in 1906. Let's explore some commonly used medical eponyms. 1. Parkinson's disease, named after Dr. James Parkinson, an English surgeon who first detailed the symptoms of the shaking palsy in 1817. 2. Lou Gehrig's disease, ALS. This is actually named after a famous patient, the American baseball player Lou Gehrig, who brought national attention to the disease. The scientific name for it is amyotrophic lateral sclerosis. 3. Addison's disease, named after Dr. Thomas Addison, an English physician who first described the disease in 1855. In recent years, there has been a shift away from using eponyms. The global medical community is working towards more descriptive or pathophysiological names that give a clear idea about the nature of the disease. The idea is to use names that can be universally understood, independent of language or culture. For instance, Lou Gehrig's disease is more commonly referred to as amyotrophic lateral sclerosis, ALS, in medical circles now. Amyotrophic refers to the muscle wasting that occurs in this condition. Lateral refers to the areas in the spinal cord where nerve cells that signal and control the muscles are located, and sclerosis indicates scarring or hardening. Well, that's a wrap on medical eponyms. These names serve not only as a way of labeling diseases, but also as a tribute to the contributions of researchers and scientists in the field of medicine. However, it's also important to be aware of the ongoing shift towards more descriptive, globally understandable terminology. We hope this video enriched your medical vocabulary and helped you understand the fascinating history behind the names of many conditions. Remember, learning is a journey, so keep exploring and expanding your knowledge.